into the markets, have customers. So there are challenges there. There is challenges around evidence, right? So you as doctors and healthcare providers know the value of evidence, but does this drug work or not? What is the evidence behind that? And as we move beyond drugs and medical devices, we also want to know evidence around on digital innovations. So the call asks for evidence around digital innovations. And then the third is the entrepreneurial ecosystem. So innovation is not going to happen without entrepreneurs who are taking risks, testing out new ideas. And these entrepreneurs need to be supported by supporting structures, by financing, by regulation, and so on. And so if you have experiences around any of these areas, please do think of contributing. And I'll be really interested in supporting evidence and publication from the East African region in high-quality international journals. So that's pretty much summarizes what I do, what my interests are. And so before I go into this panel, what I'd like to ask the entire audience, including the panel, is whether you think innovation is needed to improve healthcare in the East African region. So if you do think that innovation is needed, please stand up. So this is my way of Kirti's version of getting the audience to participate, stretch, and so on. So do you think you need innovation for your own organizations, not just healthcare systems, but your own organizations? So if you don't think you need that, please sit down. If you do think you need innovation in your organizations, wave your hands about like this, both hands, yeah. Thank you. So now is an important question. So do you think you already have the innovations that you need, or are you still looking for them? So if you're still looking for innovation in your organizations for your own work, then keep standing and maybe shake around a little bit more. I want to see who needs who needs some more innovation in there. If you have the innovation you need, then please feel free to sit down. Now, finally, this last question: how many of you think that the innovation that you need will come from India, the US, Europe, Japan? And if you think it's going to come from there, you can sit down. But if you think it's going to come from East Africa or from Africa in general, then please keep standing. So the innovation that you need is going to come from Africa, or the innovation that you need is going to come from India, Japan, Europe, US. You can sit down. Okay, see, so that was the point of this exercise, along with making sure that you have some circulation in your legs. So thank you very much for being part of this. Give yourself a big hand, and please sit down. Thank you. So with that point, I think I'd want to get into this panel discussion. Seems like the overwhelming majority of you think that the innovation that you need for improving healthcare in Africa is going to come from Africa. Is that a fair point? Great. So now to this panel. I'm going to start with a lady. So I'm going to ask you to firstly briefly introduce yourselves, but also answer this key question: is what is the problem that you think innovation is going to solve in your organizations as you provide healthcare? So just the problem that that is important to solve.
Good afternoon, everyone. My name is Jacinta Michuki. I work for MTBA as the Associate Director for Sales and Marketing. I'm happy to be here and to be part of this panel today, where we will be discussing innovation and where we will also talk about part of what we are doing at MTBA, innovating in healthcare to ensure that users, being the customers and the patients and people who need healthcare, healthcare providers, insurers, and healthcare just the whole healthcare ecosystem is covered. So that's what we do at MTBA. We've built a digital platform connecting what we call the 3 Ps, meaning the participant, the providers, and the payers. To answer your question on innovation, yes, I believe innovation is necessary in our organization, both as we innovate outward to address the issues in terms of healthcare, what I've talked about, ensuring that patients can get information in regards to healthcare, ensuring when they go to the hospital, they can easily manage their benefits. They don't need to remember too many things. So just ensuring they have a digital channel in which they can access healthcare. At MTBA, we do this by building a USSD code for all the patients where they can view their benefits, manage their dependents, track their utilization, start treatment for even their dependents from the comfort of their office. So just ensuring that people can easily be able to access. We also have built-in platforms where we educate users on different healthcare covers available. Happy that even on this panel, we have some of our partners like Penda and HealthX, and even within this group. So working with different partners to innovate. And also at KRP, we believe, at MTBA, we believe that we have to continually innovate based on the feedback coming from our users, the participants, who the payers we work with tell us. So we are an organization that is open to learning and building in innovations. We believe we can still make access to healthcare easier. We believe we can still ensure that the population is covered. Currently, it's approximated only 3% of Kenyans have access to healthcare insurance, the private healthcare insurance. Therefore, there is a whole 97% to be covered. Therefore, we need to continually innovate, continually build solutions, continually learn from the data coming from all these sectors to ensure that we build for this. Thank you.
Thanks, Jacinta. Maybe to your right, Dr. Krithi, would you like to go next? Yes. So I want to try and see if we can get the guests from outside of Kenya going first, and then.
So, in terms of innovation, what I have been doing, I'll just explain that. The innovations can happen in 2 ways, either a product or a service. And today, we have fantastic hospitals in the world, globally, including Kenya. All gadgets, multi-million-dollar gadgets you have in the hospitals. The unfortunate thing is, the poor can't access it. So we need innovations with disruptive manner, cost-effective, which can reach to the common man, which is not there in the whole world. And there where the innovation really required. So what I have done in some of my contacts, my networks, we have created a system of college students, something called patent. You must be knowing so we have told, in India, we have anyone can come up with any innovative idea and which should address a social problem, a problem of the needy, not of the rich. Rich can access anything and anywhere in the world. That 20% rich, they can go to any part of the world for their services. That 80% other class, we need services solutions for them. So what we have done is all the medical students, nursing students, allied health students, given them a platform, think and create, and immediately patent. So we have created a facilitation center for patenting ideas. And they get some brownie point for that. And you won't believe amazing number of ideas coming out, an amazing number of cost-effective solutions to reach to the common man, rural population for different tests, thyroid test, cancer test, this test, that test. So those kind of technologies are coming in terms of a product. In terms of IT innovations, all these information technology or computer related innovations, which can again help the healthcare system, is coming up in a big way. So these are two things I think need to be promoted in a large way. Every human being can do that actually. Engineers, doctors. And to my surprise, when we started doing this in last 5 years, 6 years in India, you won't believe the majority of the innovators in healthcare are engineers. The majority of innovators, disruptive innovators, are engineers. So we should think something very innovative to do this probably in this region also. Thank you.
Thank you.
Yeah, good afternoon. Thank you, Professor Komar, for really a very interesting discussion. My name is Moses Degmalwal. I'm pharmacist by profession. I'm the Director General for Pharmaceutical and Medical Supplies, the Minister of Health, Republic of South Sudan. As well, I'm a board member for South Sudan Drug and Food Control Authority, and chairperson for Product Notification and Registration in South Sudan. Coming to innovation, and as far as South Sudan is concerned, as example and problem as well, mine will be in data management. Because if you don't have good data, definitely you are not going to have good outcomes and impacts. Because all innovation have to be patient-centered for you to reach that goal, outcome and impact as well. And one of the issues we are failing, I'm talking now as public sector. I will touch some of private sector. In the public sector, where I'm responsible, and especially in pharmaceuticals, one of the issues of data and one of the challenges is fragmentation. It's one of the biggest challenge in data management in the country. And I mean by fragmentation is a parallel system in place. Our supporters or partners, we are supporting health sector in South Sudan, and even in the region as well. These fragmentations and parallel system of vertical programs, if you have that concept of holistic concept, having outcomes and impacts across the health sector, is one of the challenges facing us. Maybe in the region, the region here, but in South Sudan is one of the issues facing the public sector. And even in, if you are talking about the decision-making process, because having a good data in place is a key for taking any decision in the health sector. And that is why when we are thinking, you know, in the public sector, people, you think about availability of data, but you don't think about the quality of the data. You don't think about the processing of the data. You don't think about the analytic capacity of those who are analyzing the data. You don't think about the use of the data. You don't think about even dissemination of the data. So these are the concern as far as the public service is concerned. These are the areas of concern that need innovations in the healthcare system. And it's a real challenge in the Republic of South Sudan. As such, that's why we have to focus if we want to move forward to achieve, even talk about the universal health coverage, SDGs, etc. Without having a system in place, a clear system in place, we are generating all the data and information that will drive to that decision and the end goals that you will not achieve any effort in the health sector.
Thank you, Dr.
I'm
Moses.
trying just to give that, but during the discussion, I will elaborate more. Thank you so much.
Please, I really look forward to that. You're speaking exactly my language, that we don't have enough data and we need to think about data capture, use, and all these issues. Thank you, but we'll get to that in due course. So, Danny?
Thank you very much. I'm Danny Mutembe. I introduced myself earlier. Maybe a few things that I need to do that is probably more interesting for this panel is that following the presentations from you read the Rwanda Medical Supplies and King Faisal Hospital and the Rwanda Biomedical Center. So I'm still a board member of the Rwanda Biomedical Center, but I'm not a member anymore board member from King Faisal Hospital and RMS that changed. It used to be a division under the Rwanda Biomedical Center, which is the executive arm of the Ministry of Health. To one thing that I would like to complement from what has been said is that you need appropriate, innovative systems or applications, etc. What I've seen in some of the countries I've been to is that when you have a ministry responsible of health or another institution, the minister will come with his solutions. I've seen that in Rwanda for education particularly. And then the next minister will try to bring in another solution. In some countries, actually, it's sometimes linked with corruption, unfortunately. And what happens is you have good systems that work in silos, in different organizations that actually tends to do the same thing, that are actually driving in the same direction. What that does is, first of all, it cripples the healthcare system, talking about health. You have systems that don't talk to each other, or systems that are not interoperable. So at the end of the day, you have someone who comes to you with a solution. The person is really convinced that that is a solution for you. And looking at your diagnosis, after making a quick diagnosis, you see that you have these issues and the system is required. But does the system really plug into your ailment, into your disease? If the system doesn't talk to other systems that already exist, it means that you have to scrap what is being used. And I've seen that with insurance companies, and you know that Rwanda is doing really good towards UHC. But when you go to the Rwanda Social Security Board, that is the institution by excellence, they will use their own system. They will use, for instance, for medicines, they will use the WHO, which is the ATCDDD. Some other institutions will use that, but those two systems will not talk to each other. So, yeah, you have to have the appropriate system for your ailment. Our president once said that you have someone coming to you with donation, with support, and he says this is what you need, and maybe it's money. And like, okay, you have to use this for that. Directing you what you need to use. It's like you are in Africa. Let me use the example of South Sudan, because maybe here it's probably the warmest place that I would think of. And they bring you a winter coat. What does it really help you, to do?
Thank you,
so
Danny.
That's yeah.
Absolutely, point taken. You have to be fit for purpose, and there are a lot of challenges with how you procure innovation and manage that. So we should definitely talk about that, please.
Thank you very much. My name is Ehud Gachogo. I work with the Kenya Private Sector Alliance. I lead the youth employment work. Part of what I do is to lead a very innovative project called Agile Digital Project. And so in response to your question, allow me to share a little bit of our solution, very, very practical solution on how we are catalyzing innovation at a systems level so that then we can transform our economy and we can transform our sectors. So Agile Digital Project is a Government of Kenya project that is owned and led by Ministry of ICT, Innovation and Youth Affairs in the country, and Kenya Private Sector Alliance is one of the implementing partners. Our program aims at making Kenya a leading freelancing hub globally, and we do that by ensuring that Kenya becomes the choice labor destination for all companies globally looking for digital tech labor and every other sort of labor that is needed to steer growth in the economy. Our goal is to ensure that 1 million young people are employed annually as a result of the operations that we are implementing. So in terms of addressing the systemic issues on innovation, Agile has 3 key things that we do. Number 1 is to look at the talent pipeline, the innovation ecosystem, and the value we can add to ensure that the talent that is young enough growing and really digital savvy is having a platform where they can be able to distill global benchmark and solutions and knowledge and experiences so that they can be able to, first and foremost, be solid enough to be able to have the talent that can be used nationally, and any excess can actually be exported. So looking at digital talent as a service. The second solution that you're providing in the ecosystem, in the innovation ecosystem, is around platform transformation. I'm really very excited to hear about the platforms that are in this panel and the one that was presented here, because when we began this project, we had a very low believability that platforms can catalyze sector growth because of the kind of solutions, the integrated future, the reach that they can give in one, and efficiencies that they bring in the entire ecosystem. So we did start working with that. At the moment, you're working with well over 120 platforms cut across different sectors. Of course, majority of them are also in the healthcare sector. And these platforms have continued not only to be a solutions to business, but also the greatest contributor of labor. And we are looking at both front-end labor for services that are upfront in the business, but of course the back-end labor that is around coding, development, and technical ICT solutions. The third solution is on business transformation and business outsourcing. For us to get to be a leading freelancing country, we got to learn what India did. We got to learn what Philippines did. And this transformation was led by private sector, allowing themselves to use digital solutions, ICT, in enhancing efficiencies, building a solid labor force, and creating efficiencies that can be exported. And so we work with the private sector, we work with the public sector to catalyze and increase the volume of work that's available in the system. We have numerous examples that of how we're doing this. And so for us, we directly contribute to the innovation ecosystem by providing an end-to-end solution, both in the supply and at the demand side.
Thank you, Ehud. That's really exciting to hear, because that's often unspoken side of innovation. Like, who are the innovators? Where are they coming from? What kind of training do you need? Can you build a whole industry around a certain workforce? And this is a really great example of needing to address innovation from a systemic perspective of where is this workforce going to come from. Thank you. So we should certainly talk about that. And last but not least.
Hi, everyone. My name is Jason Wanjohi. I'm the Chief Product Officer at Savannah Informatics. And I'm here in the stead of our CEO, Dr. John Muthe, who unfortunately was not able to make it here, but felt it would be right if at least there was representation. And just for context, I'd like to say that Savannah Informatics is behind a product called Slate 360. Essentially, it's a health information exchange platform that helps the process of sending e-claims all the way from healthcare providers up to the insurers. And over the time, we've realized that this visibility has not been there for patients. And what we decided to do was to create a product called BeWell, where in BeWell, as a patient, you're actually able to access all this information and you are able to be part of the journey. So in terms of innovation, I think what the company I work for has been able to do is great. But again, I'll echo what Jacinta said. It's only just 3% of our market share that needs to be penetrated. And for me, I'd like to know how can we be able to reach the rest of the country in terms of providing solutions. And I like that the idea of interoperability has been mentioned, because it's a really big problem where we find that we have all this information cut across different healthcare providers, and it's a shame that it can't really be transferred easily. And I feel like it also relates to the previous panel where we were talking about medical tourism, where information can't easily be transferred so that we can give continuity of care. So it's such a huge problem, but I like that the panel here is really good and we can actually have a real discussion about it. Thank you.
Thank you, Jason. I think what you'll agree with me is that there's so many different problems that are being presented that we're trying to solve through innovation. So we're hearing about patient health information and insurance claims that Jason and Savannah Informatics are trying to solve. MTBA is trying to solve the ability for many more patients, many more people to have access to health insurance through wallets and savings systems. So that's one problem, because people don't have access to finance for care. Then there's a problem of technology and how do we get more innovations coming out. So Dr. Kirti was talking about encouraging young engineers and innovators to come up with solutions that are suitable for the masses. It's not just the cutting edge technology for cardiac care in a tertiary hospital, but something much more basic and usable by many, many more people. Then there's the Agile platform that is solving the problem that we don't have a supply chain or good human resources to sustain an innovation economy. And that's a really important problem. Then there's a problem of data. If you don't have data, if you don't have good quality data and large quantities of data available at low cost, you can't be solving problems because you don't know what you can't solve what you can't measure. Or is that the phrase? Yeah. And so getting data in the first place, especially in public health systems that do not have access to huge funds and financing, is a big problem. So if you don't have the data from these health systems, you won't be able to create improvement. And so that's a big problem that we need to solve. And then Danny articulated the issue of procurement of innovation. So right now, we don't have a system for procuring innovation. So like you said, somebody goes in with, I have a solution that I think works for you and I have the money that is going to be there to support the implementation of this innovation, then that tends to win, and not whether that innovation is actually appropriate for the setting and the problem that it is solving. In summary, there's a wide set of issues when it comes to bringing in and using innovation to solve problems. And while we know we want innovation, we want more of these solutions to come in, we do need to solve some systemic issues around how do we procure and bring in innovation, how do you make them solve real-world problems. So I want to make this participatory again. So I'm going to bin these responses into three categories, right? So one is human resources for innovation. The two is data for innovation. And the third is healthcare services and access to services for innovation. Right, so let's take a vote. What do you want the next question to be? So is it going to be on, so you can raise hands, is it going to be on data for innovation? Let's see some show of hands for data. Vivek and Tobias and somebody there. And in the back, thanks, 3 or 4 hands. And Vinod, thank you. Then the next area is human resources for innovation. Do we want to talk about that? Yes, there's some 2 hands, 3 hands here, 4. Okay, we have a close tie. And the third is services that are going to be provided using innovation, so financing innovation, information sharing, and so on. Do we want to talk about services built around innovation? So there's a, oh, okay, there's a clear winner here. Okay. So let's take that question and go through the group and to say, to ask this key question. So if you were to choose the problem around service delivery and access to services, because that is one of the big problems, whether it's medical tourism or access to health, is access to healthcare services. And you would want to bring in innovation to solve the problem that not enough people have access to good quality services. So whether it's in South Sudan or Rwanda, in Kenya or India. Where do you think, so it's a wide area, right? You could solve problems around products and processes. You could solve problems around financing. You could solve problems around logistics and supply chains. So there are a number of different problems you could solve to improve access to healthcare services. So from your perspective, where do you think innovation has the biggest role to play in improving access to healthcare services? Does that sound like a fair question? Because it could go into many different directions. It could go into pharma, financing, and so on. So let's start with you, Dr. Moses. So,
Thank you, Professor. Access, of course, and to service, health service, is a fundamental right. And that's why we are here today discussing. And that's why we are talking around challenges facing the service delivery in the countries, and East Africa in particular. And when we raise all this concern, we have solution in mind also. The innovation, you have to come with problems and get a solution and out of that. One of the issues of service delivery, as we put it, is system in place. We have also issue of financing. We also the issue of coordination. And that's why when I come up with fragmentations, I have a solution in mind. As far as public sector was concerned, regarding the fragmentations and vertical program, my solution always is the integrations of all vertical program under one national supply chain management or under one national policies, or have to be aligned with the priorities of the country, with the policy of the country, with the standard of the country, with all issues in the health sector. So mine in the service delivery is a complex. If you want to tackle it, you have to tackle all these issues. For example, supply chain management that was presented today. And then you are aware that during the COVID-19, the impact of COVID-19 on supply chain is an issue that we have to consider also as a regions. That if any case at any time we experience the same pandemic, are we ready really as regions to have solutions across the supply chain management? For example, we used to import all our medicines in South Sudan from Asia, from India, from China. But during the COVID-19 was an issue. And we have suggested as a regions, at least to pool all our resources together and come up with a pool procurement in the regions, where we are going to use our scarce resources within the regions, motivating, the manufacturing in the regions, and come up with a solution for access to medicine and medical supplies.
Thank you,
I will stop here. Yeah.
Yeah, thank you. That's quite clear, right? So you're going to look at innovation, and pool procurement is one of the innovations that we are talking about in the East African community, and innovators like MedSource Group and VPEG are certainly engaged in that idea that we need to pool procurement, improve supply chains, making sure access to medicines is really key, and there are innovations in the room that solve that. So Danny, over to you.
I agree with him totally, and it's very easy for me because I'll just pick ideas from him. I think that what is procurement is really important as a silo on its own, but pool procurement is really the game changer. But one thing that I just wanted to add is while we're having these systems, we really have to emphasize on traceability. Traceability is key because I said it earlier, we really have a huge issue with products coming here. And the quality of them. I'm not just going to repeat what I said earlier, but it's really a problem. And when we talk about how we can address this issue, again, we have different propositions of systems, and the implementation, unfortunately, is long term, and we don't have all that time. But I think one other thing that is really key, very important to invest in as a system, and I'm sure everyone here, public and private, will agree upon, is the electronic medical record. Of course, it is a mammoth. It's a very huge and probably opening the Pandora box here. But this is something that I would really, my 2 points. Thank you.
Thanks. So product procurement and supply chains, again, you're agreeing with Dr. Moses there, but you're bringing this entity of electronic medical records. And for the record, I have a big voice against this whole entity called electronic medical records and why it's come in, but that's a matter for a different conversation. But thank you for that.
Just shoot it straight, and I think last year we did a quick deep dive on a specific element of telemedicine and the sizable market, addressable market for that, because we're trying to look at entry points for job creation. And we were very surprised to learn that that specific element commands 66 billion Kenya shillings as we speak now. And therefore, what we're trying to do is to map up the entire value chain, and there are things that we thought that would be interesting in investing and looking in unlocking. One of them, of course, is the whole issue of the last mile delivery, because as we continue to adopt digitization and digital health type of solutions, I think we must think about final destination, the security around it and all that. The second element is around data, because I think this is not very new discussion here, but we see data points that are not just about the patient, but then there are value chain data points that are being generated that are very critical to support the service delivery. So those channels must be, of course, be looked at very keenly and have potential to really spur growth. My last one really is this. We are doing two things to transform a certain ministry, and this is really to provide specific data points that allows for digitization and a large precision of the service delivery. So even in this sector, we believe that unifying the sector and having services like general transcription, data entry support, and private sector really has to provide this blueprint and template for everyone to follow. I think we'll be able to transform the service delivery both faster.
Thanks very much, Ehud, for highlighting those points. Absolutely. So you can't have some of this happening without data transcription, making sure that there's data available, and highlighting the fact that telemedicine, and there are 4 telemedicine companies out there in the booths, highlighting the fact that this is a really important area for transforming how services are delivered and the value, capturing the value around healthcare service delivery. So, Jacinta?
Thank you. So in terms of access to services and access to healthcare, I'll speak about it from the perspective of the payers, the providers, and the patients, and around innovation around the mobile phone. A lot of Kenyans, over 30 million of Kenyans have mobile phones, not necessarily smartphones, but basic feature phones, which they use for M-Pesa and doing many other services. A lot of the things we used to do in the past and a lot of gadgets we used to carry have been translated into the phone, and therefore being able to translate this using innovation is also in healthcare. When I think about the patients, ensuring that when they go to hospital, they don't need to carry too many things, they don't need to remember again too many things. So ensuring that they can access healthcare easily using the phone, they can be able to get information, having partnerships with telcos like Safaricom, for example. We are able to educate the public about their medical spend, about available healthcare options. So that's one of the innovations we have in healthcare. When we think about the healthcare providers, when people buy health insurance or health covers, the next stage is to be able to get access at the hospitals. So ensuring that these hospitals are connected, ensuring that these hospitals can access financing. So that's one of the services we offer at MTBA in partnership with Medical Credit Fund, where we also offer loans to healthcare providers to enable them buy stock and any equipment that they may require. Also, the fact that we've been able to digitize the whole healthcare value chain, it means that claims and case assessment is done faster. Therefore, the hospitals also get paid faster meaning that this is one of the efficiencies using the digitization and ensuring, like, for example, claim assessors, when an approval is needed. At MTBA, we say within 15 minutes you can do an approval because you get an alert on the phone. Everything is digital. You don't really need to fill in a lot of forms. So that's also, it ensures access and the patient doesn't spend too much time at the hospital. For the payers as well, being able to ensure that the payers have access to the system whenever they, for example, a claim is raised at the hospital, the payers have almost real-time access to what is going on, what has been treated, and ensuring that they also, the turnaround time to both the patient and the provider is faster. So ensuring that we can actually do more innovations around the mobile phone, easy to use, accessible, and working for everyone. Thank you.
Thanks, Jacinta. Yeah, I'll probably highlight that one point from what you said, is that we need to think not just about smartphones, but also all the feature phones. It's what people use and what they have. And so we have to innovate around the technology, the devices that people have, and not just imagine that there's going to be a smartphone in every person's hand anytime soon. So we have to be realistic about innovation. Dr. Kirti?
Yeah. So I'll tell you something very interesting. Telehealth, this telemedicine, telehealth. India is 1.4 billion population. You all know that. 60% of the population don't have access to a medical qualified doctor. 60% rural population don't have access at all. Governments have tried for last 10 years all kind of means, penalty, punishment. You are posted there, the doctor is not there, he's back in city. Okay, takes the salary. They incentivize. They said, whoever will work in rural, double salary. That didn't work. All methods failed. Then they said, okay, telemedicine can be a solution to access. That also was kind of seriously prevented by the medical community. The doctors thought that will reduce their income practice. That was a pseudo perception in my analysis. It was not the truth. Pseudo perception that might reduce their income. COVID came March 2020. The same file which was lying on health minister's table for 5 years, last 5 years, was not getting approved. March 2020 it got approved without taking anybody's view. Desperate. And same doctors today who are kind of opposing it, today they're enjoying the benefit of it. All their practices have gone up. Because the same rural patient whom they were not able to see, they were not going, or patient was not coming, today they are able to see that patient sitting at their own clinics, own homes, wherever they are, in their comfort. And patients are getting huge amount of access, the rural patients, by paying $3 to $10 consultation fee. And it's a legal system of treatment today by Government of India. And it's working amazing. So that kind of innovation is the need of the hour. M-health, telehealth, there is no choice left. And we have to embrace it, learn from whoever is doing it well, quickly put in practice. Thank you.
Absolutely. Thank you, Dr. Kirti. Yeah, Jason.
So I'll start by saying that I'm not a trained medical expert, but something that was mentioned before where engineers are coming up with solutions, that's basically where I'm at, since I was trained into computer science, and I had the privilege of having a fellowship with doctors who wanted to solve problems. And the way I look at it is in terms of how do we improve access to not just healthcare, but information. And one of the things I was learning through this journey of mine is that as a common person, you might not really know which specialty you need to go to, depending on your problem. And that's an opportunity for innovation. How do we help get the masses understanding that if you have a problem with a joint, you have to go to an orthopedic person. If you have some problem with your teeth, you need to go to a dentist. And then once you empower them with education, then now when the access to healthcare comes in, it flows in such a manner where things just connect. Then the other thing I could mention is, even in terms of facilities, as a common person, how do I know which place I can go to in terms of even my distance close to me? So that's another place where innovation can come in. And I like that he talked about telemedicine, because some of these ideas were really hard to talk about before COVID. But once COVID happened, it really opened up the minds of people in terms of really coming up with solutions that work.
Thanks very much to the entire panel, because again, as you can see, that even within healthcare service provision, there's so many different angles that this can take, right? So there's innovation for remote services like telemedicine, for financing of care, but for procuring, for access to medicines and procurement. So I'm going to try and wrap this up by trying to summarize what was said here, and then asking for your votes. So, what is the most exciting areas for innovation in healthcare service delivery, according to what you've heard so far? So one area clearly is telehealth, right? So Dr. Kirti made the point that in India, we quickly were able to reach many millions of people in rural India because telemedicine became reimbursable. So that's one aspect. Who else talked about telemedicine? Yes, Ehud. So there's telemedicine as an innovation to improve access to healthcare services. That's one bucket. The second bucket is training, right? So education of patients. So what Jason was talking about is that we need to educate patients and give them the options where they can go, what they can choose, what kind of doctors they need. They need education, and we can use technology and innovation to make sure that we have a better informed population. So that, I think, is a big area for innovation as well. How do you engage the people, not giving them telemedicine because they are sick, but giving them education about what options and what choices they have, right? So there's patient education and public education. And the third one is, shall we say, access to medicines and procurement of drugs, so that if you are sick, you're not sure, there's no loss, you don't have a lack of anti-diabetics or antihypertensive medication, right? So there's, you can't provide care if you don't have products that are needed for healthcare, and pool procurement, better efficient supply chains, AI, and predictive logistics. These are all innovations around making sure access to medicines are available. So 3 buckets: education about health, and innovation around that. So let's take a vote. Who thinks that's the most exciting part of innovation in healthcare? So Mary, they have a couple of hands here around public awareness and education around health. Telemedicine, votes around telemedicine? Okay, we have about 6, 8, 10. So we have another group, much more than patient education, for telemedicine. Then the third group is procurement of medicines and access to medicines. Who thinks that's the most exciting area for innovation? So again, Vinod in the middle. So that seems like that's second place. So first place clearly is in telemedicine. It's really good news for all the companies that are engaged in this right now. Many of them, here in the audience and behind. So that's a really good point to end this conversation on. I hope it has been useful and engaging for you, but most importantly, it's been useful and engaging because of the panel that we have, spanning a whole range of areas, right? So from federations and regulations to innovation ecosystems, healthcare providers, experts in health systems. So thank you very much, everybody. Can you have a big hand?
So a better round of applause, ladies and gentlemen. So thank you so much to the esteemed panel for your candid discussions. We sincerely apologize, we are running short of time. We were to end in like 10 minutes ago, so we'll allow us to extend a little bit as we finish the final sessions for today. So at this point,